If you get COVID, you no longer have to isolate for a full 5 days, and you can go back to work 24 hours after you start feeling better, even if you test positive, as long as you have no symptoms. That's what the province announced this week. Now, advocates say those who will be most affected by this policy are those who can least afford it.
I think the announcement is really bad news for Ontario workers.
Dina Ladd, Executive Director of the Workers' Action Centre, says without a mandatory masking policy and now removal of the isolation period, many low-income workers or those who are precariously employed are left with no workplace protections.
At least the 5-day mandatory isolation period gives you the opportunity to be able to say to your boss, I have to stay home, I have to take care of myself. And it gives you a bit of a buffer against the pressure to return to work while you're sick.
Without that buffer, there is concerns that workers will have to go back to work before they fully recover. There is also concern for the impact on children.
Removing this isolation period really places parents in the awful position of now having to choose between caring for their child who may be sick and putting food on the table by going to work. I like to remind people that children are often the folks who bear the brunt of these decisions that we make for adults, because they are dependent on their caregivers. That's why when we're talking about the health or any decision that affects their caregivers, there is a trickle-down amplified effect on their children.
Pediatrician Shazeen Suleiman is a member of the Decent Work and Health Network and says that's why they've been advocating for what they call a vital support for workers.
We have been repeatedly calling on the government to legislate 10 permanent paid sick days. We know that this is an evidence-based policy that protects workers, that protects children, it protects families.
It is really an untenable situation for so many workers. If the woman that I get my groceries from at the grocery store is at work sick because they can't take time off, that's going to impact me as a customer. So if we are looking at public health policy, you need to implement 10 permanent paid sick days. And that has to be a vital public health initiative, especially if we're going to scrap 5 days of isolation.
Suleiman says the policy could also have a domino effect that will impact the already overburdened healthcare system as children head back to school.
We also see then families who can't take their child to a caregiver's appointment while their child is sick because they're working, or they've sent them to school. And that means they often go to the emergency department after hours. And I worry that we're going to see worsening outcomes for children who could have been cared for had their parents had protections to be able to stay home with them.
We've got more about advocates' calls for paid sick days on our website, citynews.ca. For City News, I'm Dilshad Burman.